Today I'm discussing about the topic food and diseases. Food and diseases, just give a brief introduction of this topic. Food and diseases. Introduction. Understanding the connection between the food and disease is crucial for maintaining overall health and preventing chronic illness. You should understand uh, what is the connection between your food and your disease in your body, and it is very important, it is very significant for maintaining your overall health and well-being and to prevent you from any chronic illness and chronic diseases. So you should understand uh, your which type of food you are taking and which disease is related with that, and if you're not taking food on proper time, you disease may come in your body and may impact your functions of your body, and may impact your may feel you discomfort in your body, inconvenience in your body, uh, because of the not proper intake of food, not proper diet you are taking, not proper nutritious foods that you are taking in your diet, and that leads to various diseases you have to face in your body. To maintain overall health being and to prevent chronic illness, you should know food, which type food you are taking, the nutritious value of the food you are taking, and the diseases which connected with that food. If you are taking in larger amount, you have to face the chronic illness and all. You feel sick in your body, feel lazy in your body, you feel some kind of inconvenience in your body, discomfort in your body, because of the connection between food and disease. If you are taking food in a over no, don't take over intake of food, and it is not good for your body. It may leads you discomfort in your stomach and all. You feel uneasy, and you feel inconvenience in your body because of the over intake of food. So proper quantity of food, proper balance of food should be in your diet. That helps to reduce the symptoms of any disease and all, and to prevent you from any major illness in your body, and to maintain your overall health. There is a strong connection between food and disease, and the types of foods we consume can significantly impact our risk of developing certain diseases as well as our ability to manage existing conditions. So the types of foods we consume have a significant impact, have a greater impact uh, at our risk of developing a certain disease, as well as our ability to maintain manage existing conditions. So types of foods, which type of food we are taking, which the nutritious value we are taking in our food, that have impact and risks on our life, and that create certain diseases in our body. That is not good for our body. That is not good for proper bodily functions, and and our ability to manage existing conditions. So so we have to consume proper amount and quantity and proper portion of food that consists of nutritious value and all. So that helps to reduce the risks of any chronic disease in our body. That leads to normal functions of our body. So it has a significant impact uh, our risks of developing certain disease. Uh, because which type of food we are intaking in our body, that is decides our bodily function, that decides our brain function, heart function, so which food we are taking, which type of food we are taking in our body, and it helps to manage our existing health conditions. So food is very important. Food is a fuel for your body. Fuel is very essential element of your body that gives you lots of energy to do your task and daily activities. Food is very important um, for your body. Then come to the importance of food. And food is essential for sustenance, for your survival, for sustenance, for sustainability. Uh, Food is very important. And that provides you nutrition required for energy, growth, and your bodily functions. Different types of foods offer varying nutritional benefits and play a distinct role in maintaining health and preventing disease. So food is essential for your sustenance, and it provides you nutrients required for energy, growth, and bodily functions. Different types of foods offer very nutritional benefits and play a different role in maintaining your health and preventing your disease from diseases. Food is essential for your body, and it is essential for your sustenance in your body. It provides you lots of nutrients, energy, and growth in your body functions. And it just offers you so many nutritional benefits if you are eating proper nutritious food in your diet, in your daily diet, in your breakfast, in your lunch, in your dinner, in your evening snacks as well. That gives you so many nutritional benefits in your body, and it plays distinct role in maintaining your health and preventing you from disease. Then come to major food groups. Fruits nutritional benefits are there. They are rich in vitamins, minerals, fibers, and antioxidants. Examples are apples, bananas, berries, citrus, fruits, mangoes, and there are certain health impacts are there. It supports your immune system, it reduces inflammation, it improves your digestion. So fruits have nutritional benefits. They are rich in vitamins, they are rich in minerals, they are rich in fiber, they are rich in antioxidant. And examples are apples are there, bananas are there, berries are there, citrus fruits are there, mangoes are there. It supports your immune function, and it reduces inflammation, it improves your digestion. uh, there are so many health benefits. There are so many health benefits of eating, taking intake of apples and all, fruits and all. Have so many. They are very much rich in these components, in vitamins, in minerals, and fibers, and antioxidants. Vegetables are there, and they have certain nutritional benefits. They are high in vitamins, minerals, fibers, phytochemicals. Examples are leafy green vegetables are there, cruciferous vegetables are there, root vegetables are there, carrots are there, sweet potatoes are there, spinach is there, cauliflower is there, broccoli is there, cauliflower is there. They have certain nutritional benefits in your body. If you taking intake of these vegetables in your daily diet, that gives you lots of energy, lots of vitamins, minerals, fibers, phytochemicals. Um, then health impacts. It lower risks of chronic disease, support your digestive health, and helps maintain a healthy weight. So major food groups. So it lowers your risk of chronic disease, it supports your digestive health, and it helps to maintain your healthy weight. So these are the nutritional benefits of vegetables. So they are high in vitamins, minerals, fibers, phytochemicals, and examples I already specified. And this uh, leafy greens, cruciferous vegetables, and root vegetables. And health effects are it lower risks of chronic disease, support digestive health, and helps maintain a healthy weight. Then come to grains. So grains are have nutritional benefits. It provides you carbohydrates. It provides you fiber, B vitamins, and minerals. Examples are whole grains, brown rice, quinoa, oats, and refined grains, white rice, white bread. Health impacts are there. Whole grains improve digestion. It reduces the risk of heart disease and help maintain steady energy levels. So there are certain nutritional benefits of carbohydrates, fiber. It contains carbohydrates like grains are there, like wheat flour is there, corn flour is there, um, jowar is there, bajra is there, ragi is there. These are the grains. So they provides you carbohydrates in your body, fiber in your body, vitamin B, minerals in your body, and they are whole grains: brown rice, quinoa, oats, refined grains, white rice, white bread. Health impacts are there: whole grains improve digestion, reduce the risk of heart disease, and help maintain steady energy levels. Proteins and dairy. Proteins, nutritional benefits are there in proteins, essential for building and repairing tissues, producing enzymes and hormones. Example: meat, poultry, fish, beans. lentils, nuts, and seeds. Health impacts are they supports your muscle growth, boosts your metabolism, maintains your healthy skin and hair, and these are the nutritional benefits of proteins. If you're taking intake of protein in your body, that is essential for building your and repairing your body tissues and producing enzymes and hormones. Examples: meats is there, poultry fish is there, beans are there, lentils are there, nuts are there, seeds are there. So it supports your muscle growth, it boosts your metabolism, and it maintains your healthy skin and hair. Then dairy products are there, nutritional benefits are there, high in calcium, vitamin D, protein, and other essential nutrients. Example: milk, yogurt, cheese. Health impact is there, promotes your bone health, supports muscle function, and helps in weight management. So it promotes your bone health, it supports your muscle function, and it helps in management of your bone. Dairy products. Then come to fats and oils. Fats and oils have nutritional benefits. It provides you essential fatty acids in your body, aids in the absorption of fats and vitamins, vitamin A, vitamin D, vitamin E, vitamin K. So these have certain nutritional benefits, fatty acids and fat soluble vitamin. Examples: olive oil is there, avocados is there, nuts are there, seeds are there, fatty fish is there. And health impact is it supports your brain health, reduce inflammation, improves your heart health. Then specific food item is here. Specific food items and their benefits. The superfood is here. Blueberries, high in antioxidant, vitamin C, vitamin K, and fiber. And benefits: reduces oxidative stress, supports your brain health, and improves your heart health. So specific food items and their benefits. Superfoods are there. Blueberries are there. They are high in antioxidant, vitamin C, vitamin K, and fiber. Benefits are: it reduces your oxidative stress, supports your brain health, and improves your heart health. Salmon is there, rich in omega-3 fatty acids, protein, vitamin D. Benefits: it supports your heart health, reduces inflammation, and improves your brain function. Kale is a high in vitamins, vitamin A, C and K, calcium and fiber. Benefits: it supports your eye health, strengthens your bones, aids in detoxification. So these are the specific food items and their benefits. Superfoods: blueberries, salmon and kale. Blueberries high in antioxidant, vitamin C, K and fiber. Benefits: reduces oxidative stress, supports your brain health, and improves your heart health. Salmon, rich in omega-3 fatty acids, protein and vitamin D. Benefits: it supports your heart health, reduces inflammation, and improves your brain function. Kale, high in vitamin A and C and K, calcium and fiber, and it supports your eye health, strengthens your bones, aids in detoxification. So these are the about certain specific food items. Then come to functional foods are there. Uh, Yogurt is there. Yogurt is a functional food, come in the category of functional food, contains probiotics, protein, calcium, and benefits are that it improves your gut health, strengthens your immune system, supports your bone health. Green tea is there, rich in antioxidant, particularly the catechins. Benefits are there, enhances your metabolism, reduces risks of certain cancers, improve your brain function. So functional foods are there. Yogurt is there, green tea is there, they are the functional foods. Rich in antioxidant, particularly catechins, and benefits are there. Enhance your metabolism, reduces risks of certain cancers, and improve your brain function. Then come to traditional foods. Traditional foods are there. Quinoa is here. And traditional foods, quinoa is high in protein, fiber, vitamins and minerals. Benefits: supports digestive health, provides complete protein, aids in blood sugar control. And turmeric contains curcumin, a powerful anti-inflammatory compound. Properties and benefits: it reduces inflammation, improves your brain health, and supports joint health as well. Turmeric has contains curcumin, a powerful and anti-inflammatory compound. It benefits, reduces your inflammation, improves your brain health, and supports your joint health. Then role of nutrition in health. The role of nutrition in health, macronutrients are there, carbohydrates, proteins and fats are essential for energy, growth and bodily function. Micronutrients are there, vitamins, minerals are critical for various biochemical processes and preventing deficiencies. And water vital for hydration, metabolic processes, and maintaining homeostasis. So, role of nutrition in health. Macronutrients are there, micronutrients are there, water is here. Carbohydrates, proteins, and fats are essential for energy, growth, and bodily functions. Micronutrients are there, vitamins and minerals are crucial for various biochemical process and preventing deficiencies. Water vital for hydration, metabolic processes, and maintaining your homeostasis. So these are the role of nutrition in health. Micronutrients are there, micronutrients are there, water is there. So it has uh, that plays a very important role in your health. It's the role of nutrition in health. Nutrition plays a very important role in your health. Carbohydrates, protein, fats are essential for energy and growth. Vitamins and minerals are various biochemical processes that preventing from deficiencies and all. Uh, and water is very important for hydration in your body, for your metabolic process, and for maintaining your homeostasis. Then consideration for food choices, nutrition balance, importance of consuming a variety of foods to ensure a balanced intake of all essential nutrients. Example, combining grains and legumes for complete protein in vegetarian diets. Food allergens and intolerances. The common allergens include nuts, dairy. Some have allergy with nuts, some have allergies with dairy products and gluten and central. Managing diets to avoid allergens while ensuring nutritional adequacy. And cultural ethical consideration, understanding the role of cultural practices in food choices, ethical consideration in food production, example organic farming, sustainable fishing, animal welfare. So these are the consideration for food choices. Nutritional balances there should be, and food allergy should be considered, and intolerance should be considered, and give consideration to culture ethical aspect of food and of person and of woman, and understanding the role of cultural practices in food choices and ethical considerations in food production. Then come to discuss about diseases. What disease is all about, introduction and brief introduction of diseases. You should understand as a student, you should know, understand, you should have an understanding of different disease, their causes, their symptoms, and treatment is essential for medical practice and public health. Disease can be broadly categorized into various infectious disease, non-communicable diseases, genetic disorders, and mental health conditions. So you have to introduce, you have to understand disease is all about and different types of diseases, their causes, symptoms, and treatment is essential for medical practice and for public health. But as a citizen, as a person, as a woman, you should know about diseases. It can be broadly categorized into infectious disease, non-communicable diseases, genetic disorders, and mental health conditions. Starting with infectious disease. Infectious disease, types of infectious diseases, bacterial infections are there. Tuberculosis is the example of TB, or tuberculosis is the example of infectious disease. Cause is Mycobacterium tuberculosis. Symptoms are chronic cough, fever, night sweats, weight loss, and treatment. Prolonged antibiotic regimen, 6 to 9 months. And another disease is pneumonia. Pneumonia causes by bacteria and streptococcus phenomena. And symptoms are cough, fever, cough, chest pain, difficulty in breathing. And treatment is taking antibiotics, supportive care. That is a treatment for pneumonia. And under the guidance and under the advice of doctor. You should take treatments of these infectious disease that comes from bacterial infection, tuberculosis and pneumonia. So these are the disease because of due to bacterial infection in your body. So number one disease is tuberculosis, TB, and number two disease is pneumonia. And causes is various bacteria, streptococcus pneumonia. Symptoms are fever, cough, chest pain, and difficulty in breathing. Treatments are antibiotics are there. Supportive care is there. That these are the treatments for infectious disease. Then viral infections are there. So viral infection disease are influenza, flu, uh, influenza virus. It cause of this disease is influenza virus, and symptoms are you feel fever, you have feeling of fever, you feeling of chilling, muscles aches, and cough, congestion. And treatments are antiviral medication as prescribed by your doctor, medical healthcare provider, and taking proper rest and taking fluids, lots of water, lots of fluids in your body. That is treatment for influenza and flu. So you are taking treatments, antiviral infection medications, and rest in foods. Symptoms are fevers, chills, muscle aches, cough, congestion, and cause is influenza virus. This is a viral infection, influenza and flu. HIV/AIDS cause human immunodeficiency virus. Symptoms are flu-like symptoms initially progressing to immune system failure. Treatments are antiretroviral therapy, that is ART, that is anti-retroviral therapy, that is ART treatment. Symptoms are flu-like symptoms initially progressing to immune system failure, and cause is human immunodeficiency virus. Symptoms, treatment is medication as prescribed by your doctor, healthcare provider, taking proper rest, fluids. Then parasitic infection, that is disease is malaria, and the cause is Plasmodium parasites transmitted by Anopheles mosquitoes. Symptoms are fever, chills, and headache, nausea. And treatment is anti-malaria drugs, chloroquine, and artemisinin. These are the treatments of malaria. It caused by this parasite, this mosquito, Plasmodium parasite transmitted by Anopheles mosquitoes. And you feel symptom of fever, you have a high fever, you feel chill, you feel have a headache, you feel nausea, and because of you have symptoms of malaria or this disease. And schistosomiasis caused by schistosomus parasite transmitted by freshwater snails. And symptoms you feel feeling of rash, fever in your body, muscle ache is there, liver and intestinal damage is there. There are symptoms of this disease, and treatment is paracetamol, the treatment of this disease. Then fungal infections are there, and disease is candidiasis. Candida fungi is a cause of this disease. Symptoms are oral thrush, genital infection, and invasive candidiasis. Treatment is antifungal medications. And for another disease is aspergillosis. Cause is aspergillosis fungi. Symptoms are respiratory issues, we have allergic reaction, systematic infection. Treatment is antifungal drugs and sometimes surgery. Then non-communicable disease, cardiovascular disease, hypertension, high blood pressure. Symptoms often asymptomatic, severe cases may cause headache, vision problems. Treatments are lifestyle changes, anti-hypertensive medications are there. These are the treatment for this disease, high blood pressure, hypertension. That is a that comes in the category of cardiovascular disease, that is non-communicable disease, hypertension, high blood pressure. Symptoms are often asymptomatic. Severe cases may cause headache, vision problems. Treatments are lifestyle changes, anti-hypertensive medications. Then card is here. Coronary artery disease. Symptoms are chest pain, angina, shortness of breath, heart attacks. Is this symptom of this coronary artery disease? And treatment is lifestyle changes, medication, surgical procedure, angioplasty, bypass surgery. Then diabetes. Diabetes is very common nowadays. Diabetes disease is very common nowadays. We can say every second person is of diabetes in India. Uh, so this is a very common disease in India. Diabetes. Type 1 diabetes, type 2 diabetes. Type 1 cause autoimmune destructions of insulin producing cells. Symptoms: frequent urination, thirst, hunger, and weight loss. And treatment is insulin therapy, diet management is a treatment. Type 2 diabetes cause insulin resistance and often linked to obesity and lifestyle. Symptoms are similar to type 1 but maybe less severe initially. And treatment is lifestyle changes, oral medications, insulin in advanced cases. Diabetes is very common in India nowadays. Every second person in India is a diabetic. Is very common nowadays. It causes autoimmune destructions of insulin producing cell. And symptoms are you feeling of frequent urination in your body, you feeling of thirst in your body, you feel too much hungry because of you have diabetic symptoms, and you feel weight loss in your body. The treatments are insulin therapy and diet management is a treatment of type 1 diabetes people. And type 2 diabetes patient cause is because of insulin resistance, and it is often linked to your obesity and your lifestyle. And symptoms are similar to type 1 but may lead to maybe less severe initially. Treatment is lifestyle changes, oral medication, and insulin in advanced cases. Then come to the types of diseases influenced by diet. Types of disease influenced by diet: non-communicable disease, cardiovascular disease, high intake of saturated fats, trans fats, and cholesterol can lead to heart disease and stroke. Diet rich in fruits and vegetables, whole grains, and lean proteins can reduce CVT risks. Types of disease influenced by diet is number one, non-communicable disease, that is cardiovascular disease, and it is because of your high intake of saturated fats and trans fat in your body, cholesterol in your body, that leads to your heart disease and stroke in your body. And the diet rich in fruits, vegetables, whole grains, and lean proteins can reduce cardiovascular disease risk. CVT is cardiovascular disease risk. Risk. Then diabetes is a problem I've already discussed with you. That is also common in this category. Excessive consumption of sugary foods and refined carbohydrates increase the risk of type 2 diabetes. And diets high in fiber, healthy fats, and complex carbohydrates help in managing blood sugar levels. Then cancer is a disease. We all know cancer is a disease, a very common disease nowadays. And it is very seen, rare cancer patients. But nowadays it is a common disease. Cancer is very normal common disease nowadays. Lung cancer is there, breast cancer is there. The lung cancer symptoms are persistent cough, chest pain in your body, where you see a severe weight loss, a coughing of blood, that is lung cancer. And treatment is surgery, chemotherapy, radiation therapy, targeted therapy, that is a treatment for lung cancer. And breast cancer treatments are lumps in the breast, changes in breast shape, and nipple discharge. Treatment is surgery, radiation, chemotherapy, and hormone therapy is a treatment for this breast cancer. That is, you see lump in your breast and you see changes in breast shape and nipple discharge. Genetic disorders. Genetic disorder is number one disease, cystic fibrosis. That is come from a genetics, come from a maybe come from a mother. Uh, that is genetics. That's come from a mother and father. That is in genetics by nature. Cause is mutations in the CFTR generation, and symptom is thick mucus protection and respiratory infection and digestive issues, that is cystic fibrosis. And treatment is physiotherapy, medications to thin mucus and enzyme supplements are there. Generation therapy, research is ongoing on generation therapy. Is a treatment for cystic fibrosis. That is, we can see women's cystic fibrosis problem in women's not able to problems of reproduction and all. So we can see this problem in women. The sickle cell disease causes mutation in the HPV generation, causing abnormal hemoglobin. Symptoms are painful episodes, crisis, anemia, and organ damage. Treatment is pain management, blood transfusion, hydroxyurea, bone marrow transplant. Then mental health conditions are there. Depression is there, anxiety disorder is there. The symptom is persistent sadness, loss of interest, changes in appetite and sleep, fatigue, and treatment is psychotherapy, anti-depressant medications, and lifestyle change. That is prescribed by your doctor. If you are in depression, that is prescribed by your psychiatrist, doctor. Treatments, psychotherapies, antidepressant medications are there, lifestyle changes is there. These are the treatments for depression. If you are going for depression, you're feeling sadness, persistent sadness, loss of interest, and changes in appetite and sleep fatigue. Then anxiety disorders are the symptoms are excessive worry, restlessness, fatigue, difficulty in concentrating. Treatment is cognitive behavioral therapy, medications, and mindfulness practices. Approach is there. A comprehensive understanding of this disease is essential for effective diagnosis, treatment, and prevention. Interdisciplinary approaches and ongoing research are critical to advancing medical knowledge and improving overall health outcomes. These are the approach of we should know about various diseases, communicable, non-communicable diseases, should have understanding of these diseases, essential for effective diagnosis, treatment, and prevention, and interdisciplinary approach and ongoing research are critical to advancing medical knowledge and improving your health outcomes. Obesity, caloric imbalance from high intake of energy-dense foods leads to weight gain and obesity. Balanced diet is your portion control are key to maintaining a healthy weight. It's a balanced diet and portion control. That is obesity. Obesity is a common problem nowadays. We all see obesity is very common nowadays. You can see around obese people, we can see around near and dear, we can see obese people. That is because of caloric imbalance from high intake of energy-dense foods in their body. That leads to weight gain and obesity. And balanced diet should be there. Portion control is the key to treatments is balanced diet and portion control to maintain a healthy weight in your body. These are the treatments for obesity. Then cancer. Cancer is because of processed meat and high-fat diets are linked to increased cancer risks. So that is, we go vegan diets and antioxidant-rich foods, fruits and vegetables, and fiber may offer protective effects. Then nutritional deficiency disease. Nutritional deficiency disease are anemia because anemia is disease is due to iron deficiency, vitamin B12 deficiency, folate deficiency in the body can cause anemia. Basically, we can see more in women's anemia. And iron-rich foods, meats, beans, leafy greens, and fortified cereals help prevent this condition. So you should eat iron-rich foods. Treatment is eating iron-rich foods, meats, beans, leafy greens, and Fortified cereals help prevent this condition. Then rickets and osteoporosis. Rickets and osteoporosis, vitamin D, and calcium deficiency lead to weak bones. Dairy products are there, fish and sunlight exposure are crucial for bone health, and foodborne illness are there, contamination of food with pathogens, bacteria, viruses, parasites leads to foodborne disease. And corn pathogens are there, Salmonella, E. coli, Listeria, and norovirus. And preventive measures are there include proper food handling, cooking, and storage. So these are the foodborne illness. Contamination of food with pathogens like bacteria, viruses, and parasites leads to foodborne disease. And common pathogens are Salmonella, E. coli, Listeria, norovirus. And preventive measures you can take for include proper food handling, cooking, and storage. Dietary patterns and disease prevention. Dietary patterns and disease prevention. A Mediterranean diet is here, high in fruits, vegetables, whole grains, nuts, and olive oil. Moderate in fish and poultry. Associated with reduced risks of heart disease, cancer, and cognitive decline. Plant-based diet is emphasizes more on whole and unprocessed plant foods, linked to lower risks of chronic disease, including heart disease, diabetes, and certain cancers. So these are the dietary patterns disease prevention. And Mediterranean diet is plant-based diet is it focuses more on your whole and unprocessed plant foods, linked to lower risks of chronic disease, including heart disease and diabetes and certain cancers. We prevent that is plant-based diets, or you can say Mediterranean diet patterns which have nutritious value and all, and it helps you reduce the risks of heart disease and cancer and cognitive decline. And plant-based diet also reduce risks of chronic disease, including heart disease, diabetes, and certain cancers. Then low carbohydrate diets restrict intake of sugar and starches, effective for weight loss and improving metabolic health, particularly for individuals with insulin resistance. Special considerations, allergies and intolerance. Common food allergens are there, nuts, shellfish, dairy, eggs and wheats. Lactose intolerance, gluten insensitivity require dietary adjustments to avoid symptoms. And cultural and social economic factors are there. Cultural beliefs are there, socioeconomic status influence your dietary choices and access to nutritious foods. And efforts to improve your public health must consider these factors to be effective. These are the allergens and intolerances, special considerations, intolerances. Common food allergens are there, nuts and shellfish, dairy, eggs and wheats, and lactose intolerance and gluten sensitivity requires dietary adjustments to avoid symptoms. And culture and socio-economic factors are there. Cultural beliefs and socio-economic status influence your dietary choices and access to nutritious foods. Efforts to improve your public health and must consider that these factors to be effective. These are the special considerations for allergens and intolerance people, and, and you should give consideration to culture and socio-economic factors. Conclusion: a balanced diet rich in nutrients is essential for preventing and managing a disease. Awareness and education about the impact of food and health can empower individuals to make healthier choices. Public health policy should support access to nutritious foods and promote healthy eating habits. So this is a conclusion. A balanced diet rich in nutrients is essential for preventing and managing disease. Awareness and education about the impact of food on health can empower individuals to make healthier choices. Public health policies should support access to nutritious food and promote healthy eating habits. Thank you all. By this, I've ended today's class. Thank you.